The Government Communication and Information System, in partnership with the Solidarity Fund, is presenting the latest scientific research findings around the COVID-19 vaccination rollout. Let's take it there live.
As well as in the communication impact, which the DG so eloquently referred to. None of this would have been possible without the incredible collaboration between GCIS and the Solidarity Fund. And this specific research, which we're sharing some of the insights on of today, was specifically funded by them. So that, of course, in itself is a fantastic accolade and support of thought leadership in this country. Slide. Okay, let's see. So a lot of research has been conducted on public perceptions, and you might ask yourself, why is that? And it is simply because perceptions are a moving target, specifically with something as unexpected and new like the coronavirus. It was crucial that as many thought leaders as possible get involved and actually conduct research. Now, we have obviously been closely involved with a lot of these studies, but the important thing was always to track where the differences lie and where the similarities lie. Now, mainly the results were very similar, and that really can be linked back to proper sampling. So whilst the different studies might have different focus areas, as long as the sampling is extremely rigorous and the data collection of very, very high quality, the results should be similar. Now, for this particular study, a half an hour interview was conducted with 2,000 citizens during mid-May to June. So these results are very new and very relevant still to today. Now, when we say that interviews are conducted across the country representing all citizens, this is sometimes a snapshot of what interviewers need to deal with. Now, why is it that we make it so hard for the interviewers, you might ask? And it's simply because it's crucial that when one bases a communication strategy on research, you have to be able to say that all citizens have been included and reflected in their perceptions. So this is an important note. I've just received a message that you are not able to see the presentation. Is that still the case, or can you see the presentation?
I can see from my side.
We can see.
Oh, okay, good.
Okay, Andrea, I've shared it from our side. It's Letitia.
Okay.
Yes.
Okay, thank you. So when we look at the respondent profile of the study, it's important to note that it literally reflects the citizens of our country. So when you look at employment status, for example, you'll see there's 32% working, 31% not working. So that would include housewives, those with illnesses, or pensioners even. So this, if you look at every part of this, really reflects all South Africans. Very importantly, the GCIS has a fantastic segmentation model of our citizens. And it was important that all research uses that as a common platform. So when in the results later we talk about rooted realists, this is what it links to. So rooted realists are primarily rural, mostly unemployed, and they reflect nearly half of the South African adult population. The city seekers are 25% of the adult population, and it's those that are trying to create a new life in cities, in urban areas. Now, they generally are, they've moved, they're mobile, they're in a new environment, and it's really hard for them to establish themselves. Those that have moved into the next level, the safely suburbans, have sometimes found a job. They're mostly in the middle income bracket. It's 6 million of our people, but they're very critical of life in general. Then the metro mobiles are even more settled. They're mainly in Gauteng, Western Cape and KZN. And the cosmopolitan capsules are probably all the people in this room, professional, mainly employed, mainly in Gauteng and the Western Cape. When we as researchers look at the dynamics of behavior change, it is very important to take a systemic view of research. So this research study focused on individual attributes and communication attributes. But one has to be cognizant of societal dynamics. One has to be cognizant of the actual demographics in South Africa. When we designed the research, we looked at 4 aspects. So if you look on this fan, the blue aspects are the individual parts of a person. How willing are they to be vaccinated? How strongly do they feel able to act personally? What are the reasons for hesitancy, and what is their most trusted source of the vaccine? Only once you have that information can you actually look at the impact and effect of communication. It is also very important to understand how fast new beliefs and behaviors are actually adapted. Now, you will all know this chart or this adoption funnel of new products or new behaviors. Now, if you look at this, you will see that on the left-hand side are the innovators and the early adopters.